I'm Allison Kelly Hedgepath, and it's so fun to be here talking to everybody in this venue. I am kind of new to these webinars, so I think there's a learning curve, so please be forgiving as I'm learning the technology. But I have the good fortune to be a cardiologist in the Boston area and have seen a number of patients with POTS and POTS symptoms over the years. And am happy to be here talking about symptoms and lifestyle changes that can really have a positive effect. So hopefully this is a great discussion and really informative for people. And I'm joined by my friend and colleague, Dr. Lee Lewis.
Hi, well, Jessica, you go next, and then I'll introduce myself and go right into my talk. So.
So my name is Jessica Laird-Guion. I am a fourth-year medical student at Harvard. I was diagnosed with POTS at 16, and so it's been a long journey to get to where I am today. And as a result of that, I've partnered up with Dr. Lee Lewis and Dr. Kelly Hedgepath to try to figure out ways to help the POTS community based on our mutual experiences having worked with POTS or had POTS. And so really excited to bring this to you all today and hope it's a great discussion.
Thanks. All right, team. So I have the good fortune today of giving the first talk, and my name's Dara Lee Lewis. I'm a cardiologist at the Lown Cardiology Group with Dr. Kelly Hedgepath, and I teach at Harvard Medical School, which is how I met Jessica. And we had created a webinar for our POTS patients. So at our group, we have over 100 POTS patients, and we've taken care of them for a long time. And we had created a 4-part webinar to educate and empower people to help take care of themselves, really, because we might see you guys 2 or 3 times a year, and the other 362 days out of the year, you're kind of on your own. So we had heard a lot from our patients of ways that we could help them help themselves. So this grew out of what our patients wanted from us, and I hope you all find it really useful. And I want to welcome all of you, and I'm going to share my screen now. And we're hoping people will ask questions as we go along. We're going to save the questions up for the end. And of course, as you know, we're not here to give medical advice, but we're here to answer questions about POTS in general and to educate y'all and empower you. So here's our team. You've met Jessica and Allison, and Carissa Kelly is our nurse practitioner. It's a 4-part webinar, and let Jessica Potts and the admins know if you all are interested in hearing the other 3 parts, because we'd be really delighted to do 3 more webinars. And we would talk in more detail about salt and compression and how to have a sick day plan, the importance of exercise in POTS, and just living with POTS in general. And I want to thank Jessica Potts and the admins for hosting us here, and for all of you for joining us, because I know a lot of you have a hard time keeping schedules, and I know some of you have already said it's not a good time for you for various reasons. You're tired, and you'll see it later online, but hoping you can share it with your doctors, with your family members, and with other people who have POTS. And as I've taken a look at your POTS support group, it's so impressive to me how all of you who are struggling with your own health issues have really reached out to help each other. And that's the beauty of that support group, and how much you all have so much experience for yourselves and want to share that to help each other get stronger. So I just shout out to all of you who are here watching, and if any of my patients are out there, shout out to you guys too, because this is not an easy thing to deal with. So let's get started. And again, each of you is unique. You all have different sets of concerns and challenges. You each bring a different set of background problems, and you're all at different points in your journey. And I know some of you are just diagnosed with POTS and don't really know what it is, and others you have been struggling for years, and many of you nurses like Jessica, or medical people who actually know a lot about it, maybe even more than I do. So hopefully there's something for everybody here today. But as I said, please feel free to put questions in the chat as we go along, and we'll do our very best to answer them. Again, not giving you individual medical advice, but giving you general information about POTS. So today I want to talk about what POTS is, the different subtypes of POTS, the physiology behind it, and how we basically start to approach treatment. And again, if people are interested, we'll go into more detail about treatment down the road. So for anyone who's Googled POTS or tried to explain POTS to someone who doesn't know what it is, it's not flower pots, it's not POT, it's postural orthostatic tachycardia syndrome. And that stands for postural, means it's related to being upright. That's the orthostatic postural part. Tachy means fast, cardia means heartbeat. And importantly, POTS is a syndrome. It's not a disease. A syndrome is a collection of symptoms and findings that very often cluster together. And because of that, there's no definite lab test that says you have POTS or you do not have POTS. But what we do in general, and the consensus approach to defining it, is that we do something called an active stand test. An active stand is we measure somebody's heart rate and blood pressure when they're lying comfortably still, and then we measure it again when they're standing upright. So when someone goes from laying flat to standing, if the heart rate rises by 30 beats or more, 40 beats or more if you're under the age of 19, or reaches a heart rate of 120 beats or more when you're standing, so any of those would be a definition of POTS if the blood pressure does not drop. So normally when people stand up, the heart rate goes up a little and the blood pressure drops a little. But if your heart rate goes up a lot and your blood pressure doesn't drop more than 20 millimeters mercury systolic, that's the definition of POTS. As I said, it's a syndrome, and the main prominent feature of this syndrome is that people are not tolerant of standing upright for a long time. So standing upright in the grocery store, standing at church, wherever you're standing, and particularly standing worse than walking, people often get lightheaded and shaky. And again, there's no one lab test that defines POTS. In addition to that feeling of lightheaded and shaky, people often describe their heart racing. So that fast heart rate, you feel it. It might be pounding or very fast. So that's the heartbeat, how many beats per minute. Sometimes people feel very tired, feel flushed, get headaches, and brain fog, difficulty concentrating. Who gets POTS? Well, we see in our clinic, and this is true in research across the world, that it's predominantly women, but anyone can get POTS. So young women, usually around the time of a growth spurt, may or may not grow out of it as they get older. And for many of you, this is not a surprise, but it can be misdiagnosed for years and mistaken for anxiety, depression. People are told they have irritable bowel. People are told they have chronic Lyme, and they may or may not have those other comorbid illnesses that come along often with POTS. But very often the POTS diagnosis itself is not diagnosed for quite some time, and therefore not treated for quite some time. So people suffer with these symptoms for a long time because it masquerades as other diseases. Now, what causes POTS? We really don't know, but we do know that it usually follows a major illness. And historically, that was usually the flu or mononucleosis. More recently, we see POTS coming on after Lyme disease, especially after persistent Lyme, and unfortunately, COVID. And I know a lot of you have joined this group because you've developed POTS after COVID. And patients who have POTS and then get COVID, they may have a flare-up of their POTS. So any illness that leaves you bedridden for a period of time, or surgery, sometimes complicated pregnancies, anything that has you at bed rest, when you then recover from the illness, and usually the illness does fully resolve, and then you try to get back to your normal life, you just don't really fully recover. And that's because the POTS may linger after the illness resolves. And unfortunately, POTS becomes a sort of a vicious cycle, a downward spiral. So if you take a susceptible individual, and we suspect there's probably a genetic predisposition, although it hasn't been identified, and then you add to that some type of a triggering event. Sometimes it's a concussion, an illness, as we talked about, a surgery. That person may develop POTS. And so they develop symptoms of dizziness, fatigue, difficulty exercising, which naturally is going to lead to that person being less active and more likely to spend more time at bed rest, which unfortunately is going to lead to more problems where the blood volume can drop, the muscles and the heart muscle in particular can atrophy, and the person gets deconditioned. When this happens, two things can occur. One is that the sympathetic nervous system, which we're going to talk a little bit more about, can kick into high gear, and the adrenal glands start to make a lot of adrenaline and stress hormones. And that causes more heart rate to go up, more GI issues, can cause headaches and other things. And the symptoms get worse. So the more you lay flat and become more deconditioned, the harder it is to try to exercise, and the harder it is to be upright. So it's a vicious cycle, and the whole thing perpetuates itself. So our goal and our hope is to help you guys understand at what point you can intervene in this cycle and prevent this from getting worse and worse and worse and spiraling downward until it's really almost impossible to walk across the room. Okay, so I'm going to step back a little and talk about the three major subtypes of POTS. Now, keep in mind that most people are a combination of all three of these. There are some who are predominantly one type or another, but most people have one, two, or three of them mixed up. So the sympathetic overdrive type that I was just talking about, where the adrenal glands and the adrenal system is really cranking out stress hormones. We call that hyperPOTS or hyperadrenergic POTS. This is when the body's just got too much adrenaline. The heart rate tends to race a lot. People feel like, I've had a patient say, I'm stuck in fight or flight mode, just constantly feeling on edge and alert as if something's going on when it really isn't. The second type of POTS is called neuropathic POTS, and this is when the veins in the legs don't constrict normally when the person stands upright. So more blood tends to pool below the waist. The third subtype is the inadequate salt retention, where it's very difficult to regulate your body's volume because the kidneys can't hang on to enough salt, and therefore they can't retain enough water. So the person's volume isn't regulated normally. So again, most often a combination of the hyperadrenergic type, the neuropathic type with the dilated blood vessels, and the trouble regulating your blood volume. So you've probably heard the term dysautonomia in conjunction with POTS. And dysautonomia basically means that there's an imbalance between the two arms of the autonomic nervous system. The autonomic nervous system is like the unconscious or automatic nervous system, and it has two branches. One is called the parasympathetic nervous system, that's rest and digest, feed and breathe, and that's the calm, low blood pressure, slow the heart rate, vagal nervous system that's most active when we're sleeping and resting and relaxed. The other arm of the autonomic nervous system is the sympathetic nervous system. That's the fight or flee, fight, flight, or freeze. And that's when the body is primed for action. So if you think about historically in evolution, our bodies evolved to be ready for action, such as a saber-toothed tiger jumps into our cave and we have to run or fight. And that's when the body diverts blood to the heart and the lungs and away from the digestive organs and the bladder. It goes to the muscles, the heart rate goes up, the blood pressure goes up, the pupils dilate so you can see in the dark. You constrict the blood vessels and the sweat glands so that you can conserve energy for the muscles. You stop digesting your food because the last thing you want to do when you're running from a saber-toothed tiger is have to stop and go to the bathroom. It's very difficult to empty your bladder when you're very agitated and your sympathetic nervous system is going strong. So there's the sympathetic nervous system, the adrenal glands, they affect every organ in the body. So when we talk a lot about the heart rate going up and the blood pressure going up, that's important. But you'll notice that for most people with POTS, with dysautonomia, it's the sympathetic nervous system that's overactive. And so very often people have symptoms in addition to the fast heart rate. They might feel like they can't empty their bladder fully. They might feel bloated after they eat or constipated. They might have trouble regulating their temperature, so they overheat and then they're freezing and then they overheat. That kind of thing is very often hand in hand with POTS because this is all about this imbalance between the sympathetic fight or flight and the parasympathetic rest and digest. So they ought to work together to achieve balance. And in the perfect world, we're in this constant fine balance between sympathetic and parasympathetic. In dysautonomia, there's an imbalance, usually towards sympathetic. And we're not going to talk a lot about this today, but one thing we always try to get our patients to understand is to activate your parasympathetic nervous system. You can bring that on and increase your vagal tone just by something as simple as deep breathing, meditating, and trying to reduce the stress. But it's not always that simple. So in POTS, this balance is disrupted and the rocks fall over. Okay, so what about coexisting conditions? And again, many of you will not be surprised to hear that very often POTS goes hand in hand with joint hypermobility and EDS, that stands for Ehlers-Danlos syndrome. So that's a really common coexisting condition. Autoimmune disorders, anxiety and being hypervigilant. Now it's not always clear what's the chicken and what's the egg, because anyone who's dealing with a chronic illness and the struggles of these unpredictable flare-ups often becomes anxious, often becomes depressed. But we do often see anxiety with POTS. Sometimes there's GI disorders like irritable bowel, that's the constipation, maybe alternating with diarrhea. Fibromyalgia, which is a syndrome of aches and pains and trigger points in the muscles, often seen. Migraine headaches. Concussion usually precedes POTS, so young women who had been athletes, typically who had multiple concussions, are at higher risk for developing POTS. And chronic fatigue syndrome. So sometimes POTS is all by itself, but often one or more of these coexisting conditions are seen as well. Okay, so I'm going to take a little, maybe 5-10 minutes to explain about blood pressure. And I feel my medical students rolling their eyes at me because this is an equation that nobody thinks they want to see, but it's really important because I find that when people understand their blood pressure, they can understand much better why we prescribe the things we do, why we recommend salt, why their body reacts the way it does to being upright. So bear with me for just a minute. And I know for a lot of you with POTS, with brain fog, it's hard to concentrate on this stuff. So you can come back to it because it's going to be recorded. But I'm going to do my best to make this really simple and straightforward. So what affects your blood pressure? It turns out there's only 3 things. So BP is blood pressure. Blood pressure is affected by the stroke volume, which is how much blood does the heart squeeze every time it squeezes. And that's going to depend on how hard it squeezes, so how strong is your heart, and how full is your heart when it starts to squeeze. How full is it? If you think about, say, a water balloon, and you fill that water balloon really full, there's more water going to come out when it retracts. And if you underfill it, there's just less to come out. So if your heart is underfilled, you're dehydrated, doesn't matter how nice and perfect and strong your heart is, and usually in POTS the heart is nice and strong, it's just underfilled and small because somebody is chronically dehydrated, so there's less blood to come out with each squeeze. So naturally, if you're dehydrated because there's less salt in water, your blood pressure is going to go down because your stroke volume is going to go down. The next thing that affects blood pressure is heart rate. Heart rate is how many times does your heart beat in a minute. So if your heart's beating 20 beats a minute, it's really slow, your blood pressure is going to drop. And if your heart beats faster, 80, 90, 100 beats a minute, that's going to raise your blood pressure. So heart rate can help bring up your blood pressure. The third thing that can raise your blood pressure is SVR, which stands for systemic vascular resistance, which is a fancy way of saying the blood vessels in your legs constrict. So are the blood vessels dilated and opened up, or are they constricted? When your blood vessels constrict, that drives the blood back up to your heart and helps increase your blood pressure. So stroke volume, which is mainly determined in POTS by salt and water and volume in the body, heart rate, and systemic vascular tone, the blood vessel tone. So that fact, taken with this fact, which is that the blood circulates in a closed loop. So most of us have about 5 liters of blood circulating in our body, and it goes from our left heart to the arteries to the body, back to the veins, and back to the right heart, goes to the lungs, and the whole thing starts again. So left heart to the arteries of the body delivers blood to all our organs, our heart, our brain, our kidneys, our muscles, delivers oxygen, then deoxygenated blood returns to the heart. So if you know those 2 things, then you're going to understand why POTS becomes such a problem when people stand up. So when we lie down, there's not a problem in POTS. So most patients with POTS will tell you their favorite position is laying flat, because when you lay down, your head and your heart and your legs are all on the same level, and blood pressure can get to your head fine, and you feel good, you feel fine. The minute we stand up, though, and this is true for people with POTS, and it's true for everybody, the minute we stand up, immediately 30% of our blood pools in the veins below our waist. When that happens, the blood's pooling in the veins, there's less blood to come back up to the heart, and therefore there's less blood to get pumped out. Less blood delivered to the vein, to the brain, can make you feel dizzy. Less blood is delivered, and you detect that with these little baroreceptors in your neck, and they say low blood pressure. They send a message to your adrenal glands, make more adrenaline, heart rate goes up, blood vessels constrict, restore normal blood flow. In the normal situation, we go from laying to standing up, and it's just a split-second unconscious feedback, and pretty soon the heart rate goes up a little, the blood vessels constrict, and the dizziness goes away. So everyone's had a little head rush if you get up too quick, but in POTS, that doesn't happen normally. And that simple act of standing up, which we all take for granted, becomes a really big problem. Because in the normal response, as I said, the heart rate goes up a little, the stroke volume goes up a little, and the blood vessels constrict a little. End result, no change in blood pressure. But in POTS, there's not enough increase in squeezing, there's not enough stroke volume, and the blood vessels don't constrict. So the heart rate has to do all the work to keep the blood pressure stable to the brain. And therefore, the heart rate increases a lot. So lying flat in POTS, normal, no problem. But standing up, if you can't constrict your blood vessels and you can't have enough volume in there to fill that water balloon, the heart rate's got to do all the work. So the heart rate is compensating for the fact that the other two aren't doing their job. And that's why in POTS, we see this very exaggerated increase in heart rate when people stand up. It's normal for your heart rate to increase a little, 5, 10 beats a minute, but if it goes up more than 20 beats a minute, that's not normal. 30, 40 beats a minute. So how do we test this? So I started to talk a little bit about the testing for POTS. So when patients come to our office, what we do is we check their orthostatic vital signs. What does that mean? That means we check their vital signs, heart rate and blood pressure, lying down, and then we repeat them standing up. And we want the person to lie down for 5 minutes, and you can even do this at home if you have a blood pressure machine and a way to check your pulse. You lie flat, relaxed, calm for 5 minutes to get your baseline. Check the heart rate and blood pressure. Then you stand up, and at a minute you check heart rate and blood pressure again, and then you wait 3 minutes and check it again. And if the blood pressure stays stable, but the heart rate increases a lot, more than 30 to 40 beats a minute, that's very suggestive of POTS. Now, some of you have gone through a tilt table test, or your doctors have suggested a tilt table test. I don't personally use those, partly because it's very uncomfortable for a lot of patients, and partly because it's not all that accurate. So many patients will have what we call a false positive test, and the tilt table says, oh, you have POTS when you don't. And a lot of patients have a false negative test where it'll say you don't have POTS when we know you do. So they do have a role, and a lot of doctors still use them, and there is some information to be gained, but it's not usually necessary to do a tilt table. You can just do that active stand test, which is really, in my opinion, a more normal replication of what happens when people actually stand up. Because a tilt table is a passive tilt, and you're not engaging your leg muscles, and you're strapped down, and it can be very scary. So it's not, what I want to know is when you're at home and you wake up in the morning and you stand up, what's happening to your heart rate and blood pressure. And I can more likely reproduce that in my office than I can with a tilt table. Some people get autonomic testing that neurologists do with skin biopsies and sweat gland density and things like that. We're not going to talk about that, but that's often done in patients with POTS to see if there are other issues going on. Okay, so now you understand POTS. How do we treat it? Well, we always want to start with lifestyle changes before we prescribe medications. That's partly because a lot of people are growing and changing, and there's a lot of other medications often on board. And why treat with a medicine if you don't need to? I'd say about 75–80% of my patients improve enough with lifestyle changes that they don't ever need to go to medication. The medications we have are great, and there's a role for them, but always start with salt compression, and exercise. So the salt, the job of the salt is to help you retain water. So if you just drink water, 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 but you don't have enough salt in your system, you're not going to be able to hang on to the water. You're going to pee it right out. So salt and then water can help you regulate your volume better. If that's not sufficient, there's a medicine called fludrocortisone that can tell your kidneys to retain salt, again, if necessary. So salt is one thing. The second thing is compression. So compression stockings, compression leggings, compression tights, Spanx, whatever it is, compression helps to push the blood from the superficial veins into the deeper veins, and it helps to keep the blood in circulation. So again, for those patients who mostly have a neuropathic type of POTS where they don't constrict their blood vessels enough, compression can be really useful. And in fact, I just had a patient in the office today who we did orthostatics, and her numbers looked great, and they looked much better than they did 2 months ago. And we figured the difference was she was wearing these knee-high compression leggings today. Everything else was the same. She's still taking salt, she's still taking midodrine, et cetera. But the compression can really make a difference. And a big study just came out where they actually looked at waist and pelvic compression, like bike shorts or Spanx, and that actually is even better than knee-high compression. So compression keeps the blood in circulation. So salt, compression, and then after you've got the salt and compression going, exercise is absolutely crucial. I know some of you have a really hard time exercising, and for some of you, you really can't exercise, but most people with POTS can and should and really must exercise to prevent the heart and the leg muscles from getting weaker over time and to interrupt that downward spiral. So in a future session, we can talk more in detail about how to exercise. And for example, starting in the recumbent position, so laying down can help. Having extra salt an hour or so before exercise, wearing compression during exercise, and very importantly, starting really, really, really slowly and building up very gradually is the key to getting exercise to be part of your regimen. We do sometimes recommend beta blockers for people who have very prominent adrenergic type POTS with a racing heart rate that's very bothersome. And beta blockers partially block the beta receptors, the adrenaline receptors in the heart. So they blunt some of that fast heart rate and pounding that can occur when these surges of adrenaline take place. So in some people, beta blockers are useful. We have to watch because they can lower the blood pressure, and for some people that's not tolerable. But a lot of patients do well with beta blockers. And then we sometimes think of other medications like Mestinon and IVIG for people who have small fiber neuropathy and other dysautonomia symptoms. Okay, and then another really important part about the treatment approach is to be prepared for the worst case scenario and to know what your triggers are. So again, those of you who've struggled with POTS for years, you probably know this very, very well. And for those of you who are new to this journey, I'll tell you, this is probably the best advice you're going to get, is to get to know your body and to get to know what kinds of things make your POTS worse and better so that you can help manage it on your own. But this, in general, is going to include not skipping meals, not eating a very big high-carb meal, because carbs can cause increase of serotonin, which can cause dilation of blood vessels, which can cause a drop in blood pressure. I had a patient who used to faint every time she went to economics class, got up after class and would faint. And we figured out she was taking class right after lunch. She was eating a lot of pasta and bread and butter and not enough protein. And that carb meal combined with sitting still for an hour, combined with standing up quickly, fainting. So that all got better when she started to eat very differently. So high carb meals can be an enemy of POTS. Hot showers and hot baths and hot tubs, relaxing and nice as they are, can cause a problem because they can cause dilation of blood vessels. So that when you're laying flat in a hot bath and your blood vessels dilate, your blood pressure may go quite low. And then if you stand up quickly, that blood again is pooling in the veins, not enough blood to your brain, you can faint or feel very dizzy. Standing for long times, such as standing in line, can be a problem. Overheating, so when it's very hot out, that can be a problem. Alcohol, same thing, can cause dilation. And For women who have POTS, you may notice that in the days prior to your period and maybe the first day or so of your period, your symptoms might get a lot worse. That's very common, and that has to do with the hormonal shifts. So knowing all these and then having a plan for when these symptoms flare, or if you get sick. So if you get sick and say you have diarrhea and you're getting dehydrated, or you're vomiting, or you're just not eating a lot, all those can lead to dehydration and can cause POTS to flare. So you want to be ready that if that happens, you have a sick day plan. So this is a nice diagram that talks about a lot of these. So also sleeping with the head of your bed elevated can help your body get used to being upright so that standing isn't quite as much a shock to your system. Instead of going from totally flat to standing, you're going from sort of elevated to standing. The compression garments can be full waist or just abdominal binders. Counter maneuvers would be if you find yourself in a position where you're standing, say you're standing in line and you're starting to feel really dizzy. It can help to constrict your pelvic muscles, cross your legs, even squat or cough, and those things can temporarily return blood to your heart. Drinking before you get up in the morning, drinking water and even taking your salt before you even stand up, putting your compression on before you even stand up can be really helpful, because again, it's that simple act of going from laying flat all night in bed to standing up that we can no longer take for granted if there's POTS involved, because that act, gravity is a very powerful force, pulls that blood down and can cause a problem. So if you're someone who has a really hard time in the morning, and a lot of patients with POTS, morning is the hardest time, getting up is the hardest thing to do, then you keep your compression by your bedside, keep your salt and water by your bedside, put all that stuff on, drink your water, wait a half an hour or so, and then get up. You may find that really helps. And then the exercising, again, anything you can do flat, like a recumbent bike, swimming, or a rowing machine, can be a really great way to get going with exercise initially. Okay. Good, so that's pretty much it. There's a wonderful book called Together We Stand, if people want to read more. It's written by the mom of 2 girls with POTS with a doctor, and it has got a lot of really good basic information. It's got recipes, and it's got things about accommodation, so that's a nice place to start. And then a lot of my diagrams here were taken from a nice review from, if you're someone who likes to see the medical end of it, from the Journal of American College of Cardiology. That article is really nice. And I want to end with a quote from the great writer Maya Angelou. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary to encounter the defeats so you can know who you are, what you can rise from, and how you can still come out of it. So thank you very much. I am delighted to take questions, and I'm going to stop sharing here.
Great, so we've had a lot of great questions come in through the comments section, and feel free to keep them coming. One theme that I was hearing a lot was some questions about blood pressure, which you did spend some good time on, but particularly, you know, some people have high blood pressure and POTS, so why does that happen? And then does the typical advice around salt and compression and those things that further raise your blood pressure, would you still recommend that for someone with high blood pressure and POTS?
That's a great question, and it's really a lot more complicated to take care of POTS when the blood pressure is too high when you lay down. But if somebody truly has very high blood pressure when they're laying and very low when they're standing, that's actually not POTS. It's probably either neurogenic orthostatic hypotension or something like that, that can be due to, we see that in diabetes, we see that in Parkinson's, and that's a whole different kind of set of approaches. So basically what we're trying to do is keep the blood pressure to the brain stable regardless of whatever position you're in. And so if you start with a standing up blood pressure and it's too low and you're feeling lightheaded and your heart is racing, the compression isn't going to make your blood pressure too high. It's just going to minimize the difference that gravity causes from flat to standing. Same thing with salt. What salt is going to do is just expand your blood volume, so that if you're someone who's chronically dehydrated it's going to normalize your volume. It's not going to overexpand your blood volume. So for most people, you know, we've all heard salt is bad for you, don't eat salt. And I have to undo that for my POTS patients because they're restricting salt and they think they shouldn't have salt. Well, the problem is you want to find the right amount of salt, and it's a little different for everybody. But to have too little salt, you can't regulate your water. And if you have too much salt, if you have healthy kidneys, most people are just going to excrete that extra salt. And we're not talking about eating junk food and processed food and pizza and that. We're talking about a healthy, balanced diet, whatever that means for you, and then adding roughly a teaspoon of table salt to that, which is roughly 2,300 milligrams of sodium. So that amount of salt should not cause someone to have high blood pressure. In fact, most people with high blood pressure can even take that much salt and it doesn't affect their blood pressure. There are very few people who have salt-sensitive high blood pressure. So if you truly have very low blood pressure when you stand up and it's high when you lay down, then you definitely want to talk to your doctor because that's probably something other than POTS. So the vast majority of people with POTS are dealing with normal blood pressure laying down that's lower but not too low when they stand up. And the goal of the salt and the compression and the exercise is just to normalize the ability to go from different positions to different positions and maintain blood flow to the brain. If either of you want to expand on that, please feel free.
I think that was such a nice discussion, Dara. So there's so many, I know you can't see the chat, but there's so many thumbs up that you're getting. So I'll just share that with you. There does seem to be a lot of questions just asking for clarification on some of the symptoms. So it's probably worth us just reviewing that because sometimes the symptoms really are your heart pounding out of your chest when you change positions. And other times some of the symptoms are a little more vague and really end up translating to more chronic fatigue. And sometimes we do see a lot of overlap between the diagnosis of chronic fatigue and POTS. So maybe you can just share with us, you know, how you think about it.
Yeah. No, and the number one question people ask is after I give that spiel, they're like, oh, is my XYZ symptom going to go away if I take salt and compression? Am I going to be less fatigued? Will my brain fog go away? Will my migraines go away? All those things. And the answer is I don't know till we get there. Yeah. So the question of what's the chicken and what's the egg comes back to, because I think patients who have, say, very severe migraines in childhood and adolescence tend to, try to avoid things that trigger a migraine, and say exercise triggers your migraine and you stop exercising, or say you have chronic fatigue syndrome or post-treatment Lyme syndrome, and so you stop exercising and you feel worse. It can evolve into a set of symptoms that can either mimic POTS, cause POTS, or overlap with POTS. So again, everybody's different. Very often we see all those symptoms, and often, I'd say 50% of the time at least, most of them get better, if not go away, but at least get better when we aggressively treat the POTS. So I've seen patients whose migraines go from like 6 a month to 1 or 2 a month, and patients whose irritable bowel gets a lot better. So I think a lot of things, the fatigue tends to get better, the brain fog tends to get better, the migraines tend to get better, because a lot of those things are the result of chronic too much adrenaline. So if your body is chronically in this fight or flight mode and your heart's racing and you're making adrenaline, it does a number on your gut, it does a number on your ability to sleep at night, and it can definitely causes a classic coat hanger headache where it's sort of in the back of your neck here like this, and that's from the difficulty to standing upright and the tension that comes from all that adrenaline. So it's a long answer to a short question, but a lot of these symptoms do get better because they are directly related to the POTS problem, which is a problem of too much adrenaline from being upright without the support.
And that's such a nice message for everyone to hear that patients do feel better, because there's so many questions in the chat here about chronicity and living with symptoms, that I think it is nice to say out loud that, you know, it is possible to really gain understanding in how your body is reacting to the environment you're in, and really making strides to understand what your specific triggers are, and then how you mitigate those symptoms. I don't know if, Jessica, you want to share a little bit about your response and some of the detective work that you've done, because I think, you know, when patients see Darren, a lot of what we do is really looking for those triggers and trying to find some specific causes in what seems like a chaos sometimes of overwhelming symptoms. So maybe some practical examples some people might find helpful.
Sure. So for people who weren't on at the beginning, I was diagnosed with POTS over 10 years ago, and I'm now a fourth-year medical student at Harvard. And I think it took me a long time to figure out exactly what worked best for me, and I think it's going to be different for every single person. But I think just giving all of the different POTS wisdom things about salt, compression, exercise, a chance, and really a thorough chance. I think there's an easy tendency to say, oh, I tried that and it didn't work for me. And I definitely kind of fell into that. But then sometimes it would take me a few different times of trying to introduce more salt in my diet for it to really stick and for me to really notice that difference. But I think the biggest thing that was helpful for me was just over time, really being persistent with compression, with salt, with exercise, and with staying really attentive to what my symptoms were and trying to figure out, okay, if I'm feeling bad today, what could have caused that? And what can I do in the future to avoid that situation or to get better? And I think really just kind of always trying to push yourself forward, particularly with activity and with exercise, as much as you can. And I saw someone just said mindset really helps too, and I would completely agree with that. And another question we've been getting a lot is on the relationship with COVID, a prominent New York Times article that was talking about COVID long haulers and POTS being one of the effects of that. So if you could touch more on that.
Yes, so that kind of surprised everybody. So in people who have had COVID, we now know that there's almost 80% of people don't fully recover from COVID. They're left with something, and sometimes it's just fatigue or a little bit of confusion, but there's a significant minority of people who end up with POTS as a result of COVID. It's probably, we just really don't know a lot about it yet. There hasn't been any science. It's really anecdotal, and I've seen it, we've all seen it. It's probably the same POTS that happens to follow the flu, a bad flu or mono or Lyme. It behaves just like regular POTS. It's just that it's a little complicated because people have been so sick, they're so happy to be better, and then they're not better. And then everybody's looking for the things that we think of with COVID. Do they have myocarditis, inflammation of the heart? Did they get some other kind of a problem? And it's, in a way, it's good because I think it's raising awareness of POTS in general. And I think people are talking about POTS more, whereas a lot of primary care doctors didn't necessarily know what POTS was. But it's that the COVID gets better, and now suddenly somebody stands up and feels dizzy and their heart's racing. We approach it, at least so far, no reason to think otherwise, but we approach it like any POTS. But yes, we see this for sure.
And is there any info on how patients with POTS do if they get COVID, or if they are any sicker than the general population?
Another great question. And, you know, POTS is a little bit understudied, as you may have noticed. There isn't a lot of research about it. I'll say anecdotally, so in our clinic, we have, 120 or 130 patients with POTS. I have had only 2 patients get it, and they both recovered quite nicely. I mean, it was no fun, and they had flare-ups of their POTS when they got the COVID, which is true for my patients when they get a bad cold, when they get the flu. When other things flare, POTS tends to flare. So we have to be super mindful with this sick day approach and catch things early. So I don't think that there's any reason to think they're going to get a worse case of COVID or that they're more susceptible to COVID. I think people who have POTS tend to be pretty young and healthy in other ways. Sometimes people with POTS have autoimmune diseases or are on a lot of medicines for other things. So if you're on high-dose steroids for any reason, if you have a compromised immune system for any reason, along with the POTS, it's not the POTS, but it's those other things that could put you at higher risk for getting really sick. But as a general rule, A seems to behave like other patients with POTS who get COVID seem to behave like other patients who don't have POTS. And should you get the vaccine? Yes, unless you've had a severe allergic reaction to a vaccine similar to the POTS vaccine. So no reason to think you shouldn't get the vaccine, and no reason to think you're going to be particularly sick if you get COVID.
So there's a couple of other questions that are really talking about some of the other symptoms that we see with POTS, and I think it's helpful, again, we talked about chronic fatigue, but to talk about some of the brain fog, some of the GI overlap, and then there's some specific questions about EDS or Ehlers-Danlos syndrome. So I think, we probably do have some sophisticated consumers in the audience. Maybe you want to just give us kind of a brief overview.
Sure. Okay, so the GI symptoms, the irritable bowel is typically sort of an alternating constipation, diarrhea, and a lot of patients also get a fullness and bloating after they eat. That is probably due to the sympathetic nervous system being in overdrive, and so blood is diverted away from the gut when the sympathetic nervous system is active. So again, like if you think about in evolution, if there's a stress, it's usually a physical stress and you want to be ready for action, and the last thing you want to do is waste precious energy digesting food. So the problem is nowadays the stress is typically not a saber-toothed tiger. We don't have to run, we don't have to fight, we just want to either get through a stressful day or it's an emotionally stressful event. And we really do want to digest our food, and we do want to move our bowels and empty our bladders. But the problem is that our brain isn't smart enough to distinguish between a physical stress where we have to be primed for action versus another kind of stress where we actually don't want to shut down our digestive system. But this alternating constipation, diarrhea, bloating, sometimes is mistaken for gluten intolerance or lactose intolerance, when often it's related to the POTS and the stress, and treating it as trying to get to the underlying condition, which is POTS in this case, can really help a lot. So reducing the adrenaline in the first place is what I'm saying is can help the digestive system work better. The brain fog is a little tricky too, and brain fog is a word people use to describe it, like they feel like their head's in a cloud and they can't quite focus or concentrate. And it's hard, especially for young people who might be students, to focus on exams and focus on studying and focus in class, because they don't have as much resilience and kind of ability to concentrate on something. And that is very often seen in POTS. And again, that may well have to do with the adrenaline and the sympathetic nervous system being constantly bombarding every organ in our body, including our brain. So that is also probably exacerbated by insomnia and not getting enough sleep, which is also common. I didn't mention that, but really common in POTS. So focusing again on the underlying problem, focusing on stress reduction and relaxation, focusing on exercise, focusing on routines with the meals, not skipping the meals, and the compression, and often the brain fog will improve. But it can take a really long time. Ehlers-Danlos is, so many of you know what that is. For those of you who don't know what it is, it's a genetic syndrome that comes in 4 subtypes. And the one that usually is seen in POTS is called the hypermobility type. There are some really severe kinds that affect the heart and the aorta and can cause fatal problems, but the hypermobility type is typically not affecting the heart or the blood vessels, but it affects the joints, so that people are double jointed, people get dislocations of their joints, And it's really a challenge to find ways to exercise that don't make that worse. So it's really important if you have POTS and Ehlers-Danlos to find physical therapy or someone who knows about Ehlers-Danlos who can guide you to exercises that are safe and aren't going to make your symptoms worse. But that's probably just a coexisting one. We sometimes see cervical spine instability with POTS, and that may actually directly affect the sympathetic nervous system by its effect on the spinal cord and the central nervous system. Slightly different than Ehlers-Danlos, but it's an instability in the spinal cord, and that's a whole different topic, but that can coexist with POTS also and needs to be addressed separately. So I saw a patient today who has to wear a hard collar 23 hours a day, and when she takes it off for an hour, she's doing exercises to strengthen her neck muscles to support her head. But that commonly goes with Ehlers-Danlos and with POTS too.
Along that line, people were also asking about autoimmune diseases in POTS. So there's a lot of patients who have things like a thyroid disease or adrenal issues along with their POTS. And then some discussion of could POTS be an autoimmune disease, and what's, kind of the deal with the research on that.
Such an interesting question. So there was some question early on whether POTS was caused by an autoimmune attack of our body's own immune system on our own blood vessels, so that the blood vessels were damaged in a way that they didn't get the message to constrict when we stand up. So that is probably a small number of POTS patients have an autoimmune attack on their blood vessels, and therefore they're inappropriately dilated and not constricting. That turns out, I mean, for a while there, it was kind of in vogue to check those antibodies in the bloodstream. It's a pretty simple test. Turns out to be pretty rare. Other autoimmune syndromes like Sjogren's, which can affect the saliva glands and the eyes, you get dry eyes, dry mouth, often vaginal dryness. That's often seen in POTS as well. So probably just coexisting with POTS, not causing POTS, but definitely the things that POTS doesn't cause, like thyroid problems or dry eyes, dry mouth, well, it can be dry mouth from the sympathetic, but dry eyes and Sjogren's, those things should be tested for separately and treated separately. So someone can have POTS and then a bunch of other symptoms and think, oh, it's just my POTS, I'm going to ignore it. But if you're concerned, unexplained weight loss, unexplained weight gain, very dry eyes, you definitely want to talk to your team, your healthcare team, and see, should I get my thyroid checked? Should I get checked for antibodies for, do I have Sjogren's? Could I have lupus? Is that why my joints hurt? So there's other things that can coexist with POTS that aren't going to get any better, even if we make the POTS go away.
A lot of people have also been asking about if you're someone who is constantly in that fight or flight feeling, that you have really high adrenaline all the time, what can you do to try to combat that?
Yes, great question. So in the short run, we can try beta blockers. So first we try the salt compression and exercise, because those things sometimes will reduce that. It's appropriate for your adrenal glands to make a lot of adrenaline when you stand up if your blood pressure is dropping, because your adrenal glands are trying to maintain blood pressure to your most precious organ, which is your brain. But if you're already doing salt, you're already doing compression, and you're trying the exercise and it's still a problem, then the next thing to do would be to take it to the next step. So I just lost my train of thought. So back up for a second to the last part of the question.
How do you, if you're someone who's constantly in fight or flight, what can you do to help with it?
So failing salt compression and exercise, beta blockers can really help because they blunt the adrenaline receptors on the heart. So they can blunt that fast heart rate, they can blunt that pounding feeling, and they can be really useful. There's a medicine called ivabradine, which is not a beta blocker, but it slows the heart rate without dropping the blood pressure. So for people who have really low blood pressure and can't take a beta blocker, ivabradine is a good choice. So those two are really good. And then a lot of people focus on really heavy duty stress reduction, there's something called DNRS, which is dynamic neural retraining, and that's sort of retraining your brain to think about stress and threats differently. And that's oversimplifying. It's a 9-week course that people do, but the basic parasympathetic nervous system with meditation, deep breathing, stress reduction, try beta blockers if needed. Sometimes anti-anxiety medications can help, sometimes they don't, but always the salt compression and exercise.
There were also some questions about how POTS symptoms vary with periods.
Okay, so I know we're running close to time, so I will make this answer quick and then we can wrap up. So yeah, so many young women who have POTS will say that they know their period's coming 2 or 3 days ahead because their POTS starts to really act up. Their heart starts to race, they're more dizzy. And sometimes it's so severe to the point that they end up either going on some type of birth control pill to suppress their ovulation and suppress their periods because it's that bad and that incapacitating. Sometimes people will have a medication that they only take 3 days before their period, like Florinaf or Midodrine. They only need it for 3 to 5 days around the time of their period, and you can do it that way too. So if it's really predictable and it's going to be temporary and you don't want to take something all month long, you can do that. So why is it? It has something to do with estrogen and progesterone. Presumably progesterone dilates or relaxes smooth muscle to get the uterus ready to accept a baby, but it also can dilate the gut and dilate the blood vessels and make POTS worse. So I don't know exactly why, but we definitely see that in menstruating women. But I guess we've reached 6:01, so I will wrap up by saying thank you, Jessica Potts, and all the admins and moderators, and all of you at home who joined in. This has been so much fun. And thank you to Dr. Kelly Hedgepeth and Jessica Laird, because our team here, our biggest goal and our biggest hope is that we can help educate people and empower you all to sort of take some of this, internalize it, and use the information you learn to sort of take care of yourself and help prevent the flares and fluctuations and unpredictability and put some of that control in yourself. So we hope we've accomplished that today. So thanks. Can't hear you, Jessica.
I don't know why my computer's being so slow. Can you hear me now?
Yep.
I don't know why it's taking forever. I appreciate you guys doing this and spending your time doing this for the group. All the questions, obviously, there's no possible way we can get to them, but being a support group, me and our admin team will go back and answer as many questions as we can. We want to go back to the one about fight or flight and the adrenaline surges. For me personally, my weighted blanket has been amazing for that. Just kind of, it's, decompressing the nerve, but the super nervous surges that I get at night. So I just wanted to add that one little thing. But like I said, everybody else, thank you guys so much for taking your time and doing this. And we hope to have, I saw many people want more. So now we have all the kinks worked out. And have you on as often as you'd like. Thank you so much.
Great. Thank you so much for having us.
Thank you, everybody.
Bye-bye.